Right, well, thanks very much, DG, and good morning to all of you, Excellencies and dear colleagues. I'm Etienne Krug, Director for the Department for Management of NCDs, Disability and Violence and Injury Prevention here in WHO. And welcome, but also happy birthday, as DG said. This is our birthday, this is our celebration. Today we're all 68 years old, and we're celebrating WHO's achievements over these 68 years, but also drawing attention to an important public health issue, diabetes, and launching our first ever global report. And we are delighted that our DG is here with us this morning. Thanks, DG, for taking the time. And I'd like to actually hand over back to you for your welcome remarks.
But, thank you, and I'm so happy to see so many of you here. This is truly a very good way to celebrate our birthday. And the 7th of April of every year is WHO's birthday, because WHO was set up in 1948 on the 7th of April. And every year, 7th of April, we choose it to promote a very important subject. And it is really wonderful to see so many of you here to promote a very important subject, attention on a very important subject called diabetes. So,
walk in and take a chair. So let's take a closer look now at the report that is being launched today, has been launched today by the DG. And as I introduce my colleague, Dr. Cherian Varghese, and thank you also to the many colleagues in the other departments. I'm thinking prevention of NCDs, nutrition, essential medicines, health statistics, DCO, Joint Medical Service for the sugar table. Thanks to all, it's been a great collaboration in developing this report. Cherian, please tell us what's in the report.
Jane, I will just take you through the report briefly. And as has been mentioned, diabetes is a very serious chronic disease characterized by elevated blood glucose. There are two types of diabetes: the type 1, which is mostly genetic and starts early in childhood, and the type 2, which occurs in adults, and also there is the gestational diabetes mellitus. Diabetes has been on the globe.
But I think it's important we hear from those who live with diabetes, because nobody knows better than them what this means. And we're very fortunate to have today two people who have come to share with us their experience of living with diabetes. Florence Banda, a young leader in diabetes from Zambia, and Maria Fernanda Bria, a WHO colleague who's with us here from Argentina. I'd like to start with Florence. Thank you very much for being with us today. You're from Zambia. It would be great to hear a little bit more about your experiences of living with diabetes in your countries, what it means for you as well as for people in general in developing countries. Florence.
The WHO Director General, Dr. Margaret Chan, the countries represented, fellow people living with diabetes, ladies and gentlemen, let me simply say all protocols observed. My name is Florence Mangango Banda. I come from Southern Africa in a country called Zambia. I come from a middle-class family and was raised by a mother.
So on World Health Day, we also wanted to hear from a staff member what it means to live with diabetes and work with diabetes here in WHO. So I want to thank also Maria Fabiana Bria, who works in records and archives here in WHO, for being with us today and sharing her story. Maria Fabiana said she would be more comfortable speaking in Spanish, so I encourage you to take the interpretation device, and I'm going to switch now to Spanish. So, muchas gracias.
Thank you very much, Maria Fabiana. Thank you very much for being here with us today on World Health Day. Diabetes has often been called a silent illness, because people live with diabetes without having been diagnosed for many years, and this can lead to further complications. This has been your experience, and perhaps you can tell us a little bit more. We heard it from Florence about the challenges that she faces in Africa. Are there the same challenges in Geneva or not? Thank you very much. Can you hear me? Yes? First of all, thank you very much for having invited me to speak. It is with great pleasure that I'm here to share my experience. And yes, indeed, this is a silent illness, as you mentioned, because in my case, for example, 13 years ago, about in 2003, I started to experience certain symptoms such as having excessive thirst. I went to the bathroom a lot. I was very tired, and I had lost about 7 kilos. My friends and colleagues used to tell me, "What diet are you on? Because you're so thin, you've lost so much weight." Well, how did I find out? Well, I lived through this with many months. How did I find out? Well, one evening, I was reading a journal, actually the newspaper Dimanche Matin, that is published here in Geneva. I was reading this article in the newspaper, and the article was speaking about all the symptoms that one can experience if one has diabetes, and I said, no, impossible.
Let's now turn to the diabetes experts, and we're very fortunate to have 3 world leaders in diabetes with us today. Dr. Shaukat Sadikot, who is the president of the International Diabetes Federation, Dr. David Beran from the University of Geneva, and Mr. Hrmz Keyhanzadeh, sorry, I probably massacred your name, from Iran, where he is the president and chief executive officer of the Gabric Diabetes Education Association. So Shaukat, thanks for being with us. The IDF has a long history of collaboration with WHO. Thanks also for the support in preparing this report and its recommendations. What actions do you and the IDF feel should be prioritized to halt the rise in diabetes?
Well, first of all, thank you very much for having me here, and I'd like to say hello and happy birthday to all of you. I'm a bit older than the WHO, but that's another point. Okay, now, basically, when we're talking in terms of preventing the rise in the number of people with diabetes, I think it goes back to a long way and something that Dr. Chan has already said, and that is total lifestyle management. And I think unless we do lifestyle management, I don't think that we are ever going to halt the numbers of people with diabetes. At the same time, I think walk the talk and everything is absolutely fine, but whatever we suggest has to be something that can be done on the ground by the countries. Like I was telling you just now, 5 years back I was at an IDF meeting on prevention of diabetes. And there were these 2 people from the United States who said that, well, the only way to do it is India and China ban all escalators and elevators. Well, I mean, this coming from a country which has more obese and overweight people than anybody else, I think doesn't work. So we have to have certain initiatives and projects which can work. That is very important.
Thanks very much, Shaukat. David Beran from the University of Geneva, as you see in the report, identifies access to insulin as well as other diabetes medicines as deficient in many countries, and the DG also highlighted that in her remarks, particularly in the lower income ones. You've worked on this issue for many years. What key steps are needed in your view to improve the situation?
Well, thank you very much for this opportunity. I think really when looking at the issue of access to insulin, we need to differentiate 2 key components. Is the availability, which Florence mentioned as an issue. Although insulin was free, it's not always there when it's needed. And so how can the push for universal health care coverage ensure that this life-saving medicine is included in benefit packages, that budgets that are put together, be it at WHO or within health systems, include these essential diabetes medicines? And also, WHO has vast experience in terms of improving the availability of medicines through supply systems, through support to member states, and how can that be used for insulin as well?
Thanks very much, David. And finally, Hrmz, we've heard about the access to medicines, but also educating patients with diabetes about self-care is one of the pillars of managing diabetes. Can you tell us a little bit more about your experience on that in Iran and the results that have been achieved?
On behalf of First of all, on behalf of my association, Gabric Diabetes Education, I would like to thank WHO for giving me this opportunity today is very fantastic because instead of birthday cake, we all tried birthday yogurt, which was quite helpful for all of us. So thank you for this initiative. As an Iranian NGO founded in 2006, we are honored for the development of the model of diabetes education school based on IDF guidelines, but implemented in our distinctive model, which are characterized by key 4 features, and these key 4 features are supposed to address the main challenges of diabetes education. First, in our model, the majority of people working in the association are type 1 diabetics like me, and both the people who are diabetes educator or the people who are a counselor, which provide counseling to the members, they are all diabetic. So this provides the opportunity of giving a service full of empathy and in peer-to-peer support style. This is what we call collective education, and is supposed to address the adherence to diabetes education. As Maria mentioned, the acceptance of diabetes is very important, and peer-to-peer support style could be very effective. The second distinctive feature, due to extensive variety of patient educational needs, Gabric Diabetes School training programs have tailored courses covering 8 target groups and in 5 educational levels. So it is really a school having different courses offering based on different needs. Thirdly, experiential learning model is the basis of entire session in which all participants have to perform a homework, turning what they've learned into practice, log their blood glucose, diet and exercise, set a goal, and share their experience in following sessions. With the appropriate support of diabetes educator, behavior change is facilitated and the empowerment is gradually built. And the fourth is active follow-up system for our members in practice through telephone call by peer counselor and sending message, newsletters, events, gathering, and etc. Members are regularly asked about their blood glucose, about their A1C level, and are given motivation and educational tips when needed by peer counselor, by a person who already have such problem. I would like to refer to one of our novel courses that are specifically designed for children with diabetes. Children needs, of course, different languages. We have developed Kipo, who is the hero of this program. Kipo is coming from Sugarland, which is an imaginary planet. All the people there have diabetes, and in these Kipo adventure stories, children are gradually understood about the importance of diabetes management. For example, Kipo have horn and has some magical power. We cannot tell a child that if you fail to manage blood glucose, you will end up kidney failures. But Kipo, the hero, if the Kipo fails to manage the blood glucose, Kipo will lose this magical power. So these kind of innovative stories can help the adherence to diabetes education by children. And finally, and in conclusion, I would like to say that this model can be implemented in other countries, and I can say this model is a combination of entrepreneurship, innovation, empathy, and experience, and now supporting 100,000 Iranian people living with diabetes, and is in line with Iranian Ministry of Health national policies. Thank you.